the reason why they're in front. It's going.
Beautiful. Alright, hello everyone, welcome back. Hello. So today we're going to go through a quick PowerPoint presentation, but before we start, can I make sure everyone's got their phones turned off, please? Again, I know I'm terrible. How dare I ask such things? And again, with the case of emergency, exit there, through the back door and through the laundry, and the loos just through the laundry. I want to quickly have a chat about the last session and what you guys remember from the last session. Anyone?
That's a while ago.
We're talking about the behaviours.
Oh, the behaviours.
Oh, okay. Yeah.
Methods of communication.
Methods of communication.
Oh, okay, that one, yes.
Different sorts of
types
dementia.
of dementia.
Yeah.
Yeah, so that's what we're going to go through today. We're going to go through different types of dementia. What is it? What actually is dementia? How does it pose communication challenges? We're also going to do a couple of class activities today. One, I'm going to try and communicate a need to you. You have to try and figure it out, what it is I want. And then I want you to partner up and try and do something like that with each other. I've also got a history questions. How would you take a patient's history? What would you ask them? And this one's 30 life questions to ask your grandparents.
Okay.
Some of them are pretty good. Hayden's actually got a good story that I'm going to make him share.
No.
Yeah, no, you're sharing it. So today, hopefully by the end you'll have a better understanding of what dementia is, what the different types of dementia and how the different types affect communication. We're going to demonstrate some skills and then you'll have an opportunity to practice the skills yourselves. So getting into it, I'm going to ask, what's something that you've forgotten? We forget things all the time.
Where your keys are.
Where your keys are, yes.
Your own son's names.
Yes, I get my kids mixed up. I do.
Passwords, different passwords.
Yes.
Oh,
yes.
yeah,
I'm
exactly.
forever having to change, especially on MyGov.
Yeah.
Because it's so rare that I log on to it. I'm like,
Wedding anniversaries.
My address.
Wedding anniversary. Yeah, I don't know if you want to admit that one out loud. But alright, so what about something that's caused you serious distress? You mentioned your car keys. Has it ever made you late, forgetting where your car keys were?
Yes, that's a good one. Yes.
Oh, not
Yeah,
so much
that's
me,
right.
but forgetting I had taken the car to the shop and walked back home.
Oh,
that's
dear.
awesome.
Fair enough.
Yeah. Came out to get in the car and it wasn't there.
Oh no. Yep.
But yeah, it was just over across the road.
Of course. There it was.
There it was.
Oh dear.
That was a long time ago. I was so young then.
I've done something very similar myself.
Yeah.
Yep.
Yes,
But it does, send you into a bit of a spin.
it does.
Yeah, it does.
Yeah.
Absolutely.
The handbag.
So as you get older,
Yes.
it would make it worse. Yes.
Yes, or where you put your phone.
Yeah.
Did you bring it with you? And you're
Exactly.
searching for it everywhere
Yeah.
just to realise that you've left it at
Yeah.
home.
Of course.
Yes.
Yeah.
So we've all, I guess, forgotten different things on different levels. Some of it causes more stress than others. So communication challenges. We're going to just have a quick chat about what a communication challenge is. You could have different things like a language barrier. Someone from a different country may have a really thick accent. They could be asking you for something. You've got absolutely no idea. And you're not exactly going to be carrying picture cards around with you.
No.
So a bit of a chat on how to overcome something like that. Okay, so what is dementia? It's generally progressive. When you first get diagnosed with dementia, it's usually sort of as it's progressive on, you get your minor symptoms that start, such as your memory loss, your behavioural changes. But it can actually progress quite quickly when you get to that certain stage. So the diagnosis can take months, a really long time, but you still have an understanding when that diagnosis comes, what your future may hold. And I think that's one of the most challenging things with dementia. It's when you get your diagnosis, because you know you still understand what it is and what it's got in store for you. Okay. There are over 100 different types of dementia. There are so many that cause different issues in the brain, from your memory to behaviour, even just little things like where you live, your family, can be quite challenging. And even the simple way you do things, you could forget how to drive your car, or even that you ever had a licence in the first place. I was just having a thought, could you imagine, where's a famous race car driver?
Craig Mounts.
Yeah, he'll do. Imagine him all of a sudden not being able to know how to drive, or that he was ever famous. Did he drive for Ford?
Both.
Holden.
Holden and Ford?
Yeah, he did both.
Yeah.
Yeah.
That'd be
Mostly Holden.
go to Ford. Just quietly. Average life expectancy of dementia is about 8 to 12 years after diagnosis. So some people it's less, depending on the type of dementia that they have. Some people it's more. It again depends on the lifestyle and the current living situation of the person. Alright. Symptoms of dementia. Oh, did it just go straight past it? Go back. Thank you. Alright, so you've got your loss of memory, which we've had a chat about. Even things like concentration, planning and organising. It's difficult to make decisions, even on your shopping list. Things you usually put on your shopping list and you can't make a decision on what flavour cordial you want. Solving little problems are all of a sudden big tasks. Language difficulties on understanding what other people are saying or finding the right word for something. Shopping centre is a pretty basic word. Trying to communicate that you need the shopping centre without knowing what that word actually is can get a bit tedious, and you can get really frustrated with yourself. Right, so we're going to do a class activity now. I am going to try to communicate a need to you. You have to try and figure out what it is that I'm trying to tell
This
you.
is going to be great.
This is going to be fun.
I'm not going to make it too
charades.
difficult because charades. I'm not. I can still talk to you. I just can't tell you. Remember the word that I'm searching for.
Yeah.
So I'm like walking around. I need something, but I don't know what it is.
Is it toilet?
No, good guess though. Like,
Hungry. You're hungry.
yes, I'm hungry.
Oh,
Tummy. But yes, you've got to look out for cues.
Yeah.
yeah.
Body language.
Yeah.
So I want you to work sort of in pairs and think of a need in your head that you need and try to communicate it to the person next to you. See how you go.
Do you want to be my little partner?
Come on, Maddie. Right, Sean, what is it that you need?
Yeah.
Oh,
It's all right. Don't be shy.
yeah.
Wait.
Easy for you to say.
No, you're Maddie.
Look at me, man. I'm trying to entertain 8 people. Not as easy as you think. So come on, you can do this.
Are you
Yeah,
tired?
sure.
Oh, you're very
Beto, work with Steve. Dad, come and work with Liz. Try to communicate a need that you might have. Alright, Maddie, are you feeling nervous?
No.
Go to bed.
No.
Yeah.
You've got to look at Sean. You've got to try and tell Sean what it is.
Yeah.
Don't be shy, mate. It's okay. I know you get a bit anxious. You
Alright.
got this.
Alright.
You got this.
Communicate.
Simple.
Yeah.
Oh, you've got a
You
drink
want a
bottle
drink?
down there. Maybe you use it
Coffee.
as a prop.
Yeah.
Dad wants a coffee.
Yeah.
All right.
There we
Swap,
go.
swap.
Should I have
Swap over.
We did. Yeah, drink. There you go.
There you go. Was it easy or? Yeah, of course.
Oh, God.
I don't see why not. Just not rude.
Oh, damn it.
Walk around like.
That could work.
I put forward an hamstring, don't I?
She can remember those words.
Oh, yeah. She remembers.
Have you
Okay.
swapped over, had a turn?
Oh, be like that lady that
Hey.
seen that time that was cruising around on her ass.
Oh,
Oh,
at the
the
nursing home over here.
Yeah.
Oh, you were saying about that.
Yeah.
Oh, poor thing.
Yeah.
Some people find different ways to communicate
No
what
one
they
knew what
want,
she
and
wanted.
it could be
Yeah.
No, clothes probably.
Well, she didn't because she actually took them off and threw them. So.
Oh,
oh dear.
Okay.
That'd be more of a behaviour of concern
Yes.
or attention-seeking behaviour, maybe. But
Yeah.
It's just doing the
Really
Highland fling,
irritable.
Doing-
shuffle.
doing the Highland fling on and unsteady on your feet.
So it was
You
a
probably-
wedding
you probably
day.
wanna
She was
scratch
going
and
like
rock.
that.
Well, she must be because as she was sliding along, she was banging on the wall.
You see some funny things when you're in the nursing
You
home.
gotta laugh,
It's some of it
Yes,
you do, but
you do.
at the same time, try
You
not
gotta
to
be
do it until
professional.
the end.
Yeah.
We have to
That's
be.
hard though. It's really difficult to remain professional when you're in a funny situation and poker faces. Don't have the best.
No painting
No.
walls today.
And I reckon it was,
Not a good
nearly,
idea.
I reckon it was nearly 40 minutes or so before they actually encouraged her to cover up and,
Oh,
and go back to her
Oh,
room.
really?
Yeah.
She liked being in the Nikki
Yeah.
nude. She's probably from a nudist camp.
It was
from way back
liberating.
From the CV.
She liked the feel of the air blowing around her.
Yeah, maybe. All right. Well,
Moving on.
yeah.
Maybe
Well,
she was just
Because
because
me,
she was
feeling
All
sick.
right. We'll bring it back in. I'll start with you two. What was the need you guys were communicating?
Thirsty.
Yes.
I was thirsty, so
Yeah.
Yes.
dry tongue and all that.
But
Yeah.
I was very, very tired.
You tired.
Yes.
Okay, so were you giving each other verbal cues
No,
or
no.
non-verbal cue or just body
No,
language?
body language.
Yeah.
Yeah, it's probably one of the easiest and hardest
Yeah.
things at the same time to read because,
Yes,
you know, you
yeah.
could, I'm thirsty, I want to drink. Some
Yeah.
people could indicate thirst as more of a, that could be a confusion thing.
Yes.
Like,
Yeah.
Exactly.
don't know
Should
what
be
it,
harder to recognise.
to recognise.
Yeah. Yeah. Absolutely.
Yeah, and you guys, what were you communicating?
sleep was one, just through acting out all the body language, and Hayden picked up sleep pretty quickly.
Yes.
The other one was he through body movements indicated they needed to have a wash.
Yeah.
Wanted to sleep, so-
Yeah, wanted to have a shower. Wanted
Get
to,
one over a shower, brush teeth or
yeah.
stuff like that. Yeah.
Yeah, and were you using verbal or non-verbal?
No, just non-verbal, just actions of like washing the body and like brushing teeth. And
Yeah.
yeah.
It's a good one. You guys down the back, what were you?
Dad needed a coffee.
Oh, okay, yes. Not much longer now. It's
And
been
he's
a couple
serious,
of
he
times.
No, it was just non-verbal. We did a bit of
Yes.
staring. And I
Yep.
was
And you?
obviously knowing that he wanted
Beer.
Beer,
Oh,
yeah.
That's why I was stuttering, because he wanted that beer.
It's 12 o'clock somewhere, I suppose.
Exactly.
And you guys, what were you?
Maddie wanted a drink. You used his drink bottle there as a cue.
Yeah,
for a
That's
drink.
good, yeah.
I wanted to make a phone call, so I just
Yep,
phoned her.
yep. Yeah, nice. And that's a thing you'll find also in the nursing homes is phones. A lot of the oldies, bless their socks, have got no idea how to use mobile phones because the technology is so rapidly evolving, and when they were young they still had to dial an operator to
Yeah.
put them through to wherever it was they needed. So you'll find, yeah, you'll find a lot of them asking you, can you please help me, I want to make a call. But I've got no idea how to use this phone that my daughter, my son, my grandchild have bought for me.
Or don't forget to put it on charge.
Yes.
One of my friends whose mum's in a home, she's got a phone, but she doesn't know to put it on charge, so
Okay.
someone's going to make sure to do that for her.
Oh no. Okay. Okay, so we're going to go to the next one. It's normal to forget, but sometimes it's important to look deeper. Now, I remember discussing this before about it's a normal thing. We've all kind of forgotten where we parked our car. Have you ever forgotten what colour it was?
No.
Have you ever forgotten if it was a big car or a little car?
No.
What
No.
make it was?
Not yet.
Confidence, I like it. So could you kind of put yourself in a position where you are at the supermarket, you've walked out, you've got your groceries, and you stop and you're like, I know I drove myself here.
It's scary.
I have totally forgotten what car I drive, what colour it is, how big it is, and where I parked it. So you find it's another stressful situation.
That would be stressful.
Really
wouldn't it?
hard.
Very stressful, especially if you live, say, a 20-minute drive from home and walking's not really an option.
Yeah.
I suppose you could catch a taxi, it's there. But it's really stressful thinking you know that you drove yourself there.
Yeah.
But now all of a sudden you forgot all about your car.
I've forgotten where I parked my car before over at Colonnades and just walked around with my thing, just pressing, locking the car until I hear, oh, there it is.
That's a great idea.
Absolutely.
That's a fantastic idea.
So it seems like all more about short term.
Yes.
Short term.
Dementia is, depending on the type, it can be more short term because you get the people in the nursing home with you who will tell you stories from their childhood that they will remember vividly from when they were 8, 9 years old, but they can't remember they've had children.
No, that's right.
And that's the most, they'll tell you everything about farming that they learned when they were kids. But they couldn't tell you anything about the modern house that they grew up in, or their kids grew up in.
No.
Yeah. Alright, so we're going to go through different types of dementia. And like I've mentioned before, it is an umbrella term, meaning there's so many different things that can just go in the same category. And dementia, like we said, there's more than 100 different types, and it's so difficult to pinpoint what the actual cause of one person's dementia is, whether it even has a cause. It could be more environmental or just degeneration, which happens. Sometimes our bodies break down. It's a horrible thing, but they just do.
My hamstrings.
Your injuries are from sport.
They're still shot to pieces.
I know. But dementia can also be caused by traumatic brain injury. It's not always just a breakdown of cells or disconnection of the way the tissues connect, but it can be from a car accident. You could get smacked in the head with a football or any other kind of traumatic injury. Just even the slightest little knock can cause dementia of some sort, because dementia isn't always full-blown memory loss. It can be a behavioural change. Stroke can cause dementia. So we're going to have a look at Alzheimer's, which is the most common. Go back, you went too far. There we go. The most common of dementia is Alzheimer's. Everyone's heard of Alzheimer's. That's more the pleasantly confused. I love that term because sometimes it's not so pleasant. It can turn not very pleasant very quickly. And this is, it changes the chemical connections in the brain cells and they're lost and the cells die. But this one doesn't pose so many behavioural challenges or communication challenges. This is a very slow degenerative decline. Vascular dementia. To me, I mean, everyone will have their own experience with dementia when you're out in the workforce, but to me, vascular dementia is the most brutal.
It is, yeah.
Absolutely, because then
I get so sad.
yeah, depression, and that's where the aggression comes in. Those with vascular dementia, I find, like I said, you all have different experiences, but I find it's the most aggressive, it's the most depressing,
It is,
and it's the nastiest out of all of them. Now this one, nutrient supply to the brain is reduced because of narrowing or blockages of blood vessels. So this one's mostly caused, or I shouldn't say mostly caused, but stroke is a common cause of vascular dementia, and some of the brain cells just just die.
Mm.
And yeah, periods of severe acute confusion. This one, I suppose you can discuss it till the cows come home, but you're not going to know it until you've actually experienced this one face, and it's very, very confronting.
It is, yeah.
That's why I suppose care plans are so important when you're looking after someone who has dementia. It's important to know what type, so you know how to deal with it yourself, because there's so many different ways. This vascular dementia is more prone to delirium or hallucinations. Have you ever experienced someone having a hallucination?
Yeah.
Do you want to share your experience?
Oh, she thought she was seeing things going up the wall, this poor little lady.
That's a common one.
Yeah,
Really
ants.
common.
Yeah.
Ants,
And she
yeah.
was trying to get them. So
Yeah.
the visual, yeah, she was seeing that.
Anyone else?
Oh.
No?
When Nan was in nursing home, didn't we? When we went up there one time, they said that Nana was running around chasing. They thought she was chasing people, and she was trying to jump over the. Thought she was jumping over the fences out in the garden, and
Oh, I can't remember that.
you can't remember that. And they were having a good old laugh.
Okay.
Laugh
No,
about it,
I
'cause
can't remember that.
Yeah, she thought she was chasing someone.
Wow.
Wow.
Yeah, no, I can't remember that.
Yeah.
It'd be
It
so
is very
weird
frightening.
to them too.
Yeah. It wasn't like a scary situation
No,
for me.
no.
So it was more
More
like a
funny,
funny
yeah.
thing that
Oh,
Nana thought
yeah.
she
No,
was,
that's good.
Okay.
whether she was hallucinating or whether she just
Yeah.
was remembering back to when she
Remembering,
was
yeah.
a,
She was just
That's
little.
another
Yeah.
thing too. You
Yeah.
find a lot of people acting out memories or different scenarios to try and connect the dots as to what
Yes.
they're actually remembering. But going back to hallucinations, I'm not sure if I've shared this one with you guys before, but when I was working in a nursing home, I was looking after a lady. Had a carer, gentleman working with me because this lady was to assist, and she'd see spiders everywhere.
Oh, yeah.
And they were crawling all over her and crawling all over the walls.
Oh,
I couldn't imagine anything worse
Yeah.
than thinking that you're covered in spiders of all the things. It's like,
Yeah.
torch the place down. So the carer I was working with just pulled out a can of air freshener and pretended that it was
okay.
spider spray
Yeah.
Yeah.
and sprayed the room. And in her mind,
Take that.
spiders are gone.
Okay.
They're all dead.
Yeah.
Yeah.
So she would get out of bed and let us help her. So
Mm.
sometimes you got to play into these delusions and
You
these
do.
hallucinations,
Yeah.
even though you can't see them and you know,
Mm.
all right, they're
Yeah.
Go
having,
into their world.
yeah, having visions here. You've got to play along.
Because it's
Yeah.
pointless telling the person they're not there.
No,
You've got to
no,
Accept
that's
it.
pointless because that'll
play
make
into
them,
it.
that could make them more aggressive
more aggressive
Yeah.
and less
and
trusting.
less trust. Yeah.
Absolutely.
Yeah.
Because if
More
they,
anxious.
there's something's really real in their mind, you can't see it,
Yeah.
and you tell them, you're just imagining it. It's like, I wouldn't
Yeah.
want someone to
No,
say that
don't
to
say
me.
it. No, you give them a punch.
I wouldn't be very happy about it. It's like, it is real. I can
Yeah.
see it. It's there. It's happening
It's
to
almost
me.
like telling a schizophrenic that they're not seeing what they're seeing.
Exactly.
Yeah, well, yeah. It's
Yeah.
not that dissimilar.
Yeah.
It really isn't. I mean,
No.
schizophrenia, I suppose, is a whole different ball game.
Yeah.
But the hallucinations themselves are pretty much the same.
Yeah, they will.
Yeah.
Heavy
Good
water.
point for that. That was a really good one. I like that. Okay. Lewy body dementia. Now this one's more related to Parkinson's disease. You know how you get the,
Yeah.
the shakes and both are due to Lewy bodies, which is just like a build-up of plaque or proteins in the brain. So it causes the same sort of motor symptoms. So you can't get the fine coordination skills are gone, and that in itself can cause all sorts of trouble. I remember looking after a lady, who had Lewy body dementia, and she had the shakes and everything that was with it, and she used to be an avid sewer.
Oh.
She loved to sew, and she used to spin her own wool and all sorts of things, and because she couldn't do that anymore, she would get the aggressions. When she saw fabric she'd buy it, sit there and try to stitch and couldn't get it right and get so frustrated. The ladies actually ended up buying her, not just, it was some modified sort of sewing machine
Oh,
thing.
wow.
I can't remember what it was called, but it helped her sort of steady her hands so that she could do the sewing that she needed.
Yeah.
So that you can implement all different instruments and equipment to combat different symptoms. Some of them aren't very cheap, which is why
No.
the options aren't always available.
Yeah.
So we're talking about various types of
Dementia, yeah.
Does it happen where somebody can get 2 or 3 types, or is only ever one of those types?
That is a really good question that I don't fully know the answer to. That is something I should have to research. But my understanding is this one would be like more predominant and more easy to tell, okay, you've got this one. You could probably have other underlying types of
So
dementia,
you're trying to say like a multiple personality sort of dementia.
No, but the
but say vascular dementia and Lewy body
Yeah,
dementia
yeah,
at the same
yeah,
time.
Yeah.
That is a really
the
good
behaviours
question.
that the person is displaying would lead you to believe that there's more than just Lewy body here. There is something else, or another type of dementia having a bit to play as well as this.
It's a really, really good question. I'm going to look into that. Thank you.
Like having dementia and also like a few signs of Alzheimer's.
Yeah,
there, would that be-
yeah.
Yeah, yeah.
Okay, frontotemporal. This one affects the front and the side of the brain, as I suppose the name kind of suggests. Now this one is where the parts of the brain are damaged when clumps of abnormal proteins form inside nerve cells. This one can be more associated with motor neuron disease. Motor neuron disease is quite different, but the symptoms between frontotemporal dementia and motor neuron disease are very, very similar. Covers the whole range of conditions. This one I think is another brutal dementia in the fact that, like motor neuron disease, it breaks down your body and your short-term memory loss, but everything else is still there. So when all those muscles break down and you're bedbound, you're still pretty much 100% in your brain switched on, like you're a prisoner in your own body. Dementia's cruel. It's very, very cruel. Did I just get past that? Okay, so thought. Hang on a minute, where are you? Yeah, as people live longer, dementia is set to increase, but that's just not necessarily as people live longer. It's more population growth. You look around the world and now as compared to how it was 50 years ago, I'm not sure on the exact figures, but obviously we've got a lot more people around now, but the population as it ages and as we learn more about dementia and how to diagnose it, it's more likely that someone you know will end up with dementia. 1 in 14 people over the age of 65 are diagnosed with dementia, and 1 in 6 over the age of 80.
They're getting younger too, Vic, aren't they?
Oh yeah, yes.
Just scary.
Don't quote me too much on it, but early onset dementia. Does anyone know much about early onset?
Nope.
Yeah.
No, it can affect teenagers.
Yes. We had a lady that was 40.
Yes.
She passed away when she was 42 with that.
Yeah.
Started when she was young.
Yeah.
The first time I'd seen it and asked anyone like that.
I've done
I've
some
heard of children.
So sad.
children.
as
Yeah,
well.
absolutely. I did. I've done a couple of shifts at Minder House up in Brighton. I think it was Brighton, yeah. And in one of their wards there, and it was a dementia ward, and there was 3 teenagers in there. The youngest was 14, who had
Sad.
dementia. So it's not just something that affects the elderly. It's something that can affect it's rare. It is very rare, but it does happen. Women are more likely to be affected than men. Well, this is, I don't know. I don't think there's no
I
sort
could
of,
say, but I won't.
Yeah, no. Sometimes it's safer to keep your mouth shut, maybe. Shush you.
We're slowly losing it, are we?
Well, I've got a few opinions too, but
yeah,
I think
yeah, already.
to myself.
Yeah.
Prevention. Healthy living is pretty much the only way you can give yourself any kind of hope of preventing this. I know we were talking about the memory games and things like that. There's no evidence to suggest that they do anything to prevent dementia. It's about just looking after yourself.
So it becomes a physical thing.
Yeah, it certainly does, yeah. Yeah. Keeping yourself healthy, even 20 minutes of walking a day. And that's not just good for you physically, it's good for you mentally too. Sometimes if you go for a walk in the nice crisp air, you come home and you'll just feel better.
Yeah.
Sometimes you won't, but sometimes you might. For myself, I find if I need to go for a walk, I prefer to do that than stay home and make a bad situation worse.
Yeah.
Go for a walk, get out the house, otherwise people get punched.
End up
Yeah.
up a tree.
End up with black eyes.
Hey, I didn't do that, you can't say I did.
Yeah, look, I've got it to prove it.
What happened?
She beat me up.
I did not. Don't tell lies.
No, Mitchell beat me up.
Oh, that's better.
Bit of a headbutt.
Okay, so why diagnose and treat dementia early? Well, it's like any disease. You catch it early, you get on top of it, you've got a better chance of treating it and improving quality of life. It's like, it's a bit weird to, I suppose, compare cancer to dementia, but the earlier you catch cancer, the better your treatment options are. With dementia, it's the same thing, because there's medications that can help with the protein and the plaque build-ups in the brain. There's so many things that can help. They won't get rid of it, but it'll slow the progression enough to give you a good quality of life. And I think at the end of the day, that's what it comes down to, is quality of life. Okay. Diagnosis. Okay, so blood tests. We get blood tests for everything these days. Your blood will tell any story that your body needs to tell. And history taking, which will take us to our next exercise. So I've got 30 questions here. We're going to take a brief patient history. I'm going to hand them out.
Thank you.
You're welcome. You're welcome. You're welcome.
Did you bring your eyeballs with you?
I just said this is bigger.
Thank you.
You're welcome.
Ah, got the car yet. I'm there.
This is to ask your grandparents, mate.
Just ask Nana and Papa.
Now, as carers, you wouldn't be doing a patient history as such. That's more for the nurses to do. But it is always handy to take your own history, ask your own questions of the people you're looking after. They might tell you something that they haven't told their nurses.
Exactly, yeah.
You might ask questions that they weren't asked.
Yeah.
So these ones, I love these questions. I think they're fantastic.
I'm going to keep this and
Yeah,
all the
absolutely.
answers for.
Feel free to keep them now. I want you to work again with the person sitting next to you
Yeah.
and have a bit of a chat. Ask.
So just pick out a few.
Pick out a few
Okay.
and have a bit of a chat about. And this gives you an opportunity to learn something about each other too.
What are you going to ask me?
Come on, Maddie.
About the brothers and sisters. My brother has a fight.
Should I go back this way then?
My sister's an idiot.
Oh, come on.
Right, there you go. Fair enough.
Well, here we go. For you, Dad.
I was born in Port Pirie Hospital.
What was your favourite subject?
Nothing.
I don't see anything like it. What
Normally
meaning?
it's placed in
Yeah.
class five,
It's a hard one.
going
Well,
on.
would you?
No,
I passed that in the highest mark.
Early,
Yes,
memories.
yes.
early
What
twenties.
about Dad?
Do you know why you would call the name of it?
Did
Was,
No?
Yes, yeah,
in
I've
the
got
summertime,
Yeah,
swimming
they
out in
last
the
a lot.
backyard.
Where are they?
Well, my sister's only.
Yeah,
Yeah,
already
Yeah,
they might
right.
know.
Yeah, right.
Yes,
Okay.
yeah. She's on
Nice.
the other side of the
What
road.
were some of your hobbies growing up?
Was it?
Yeah.
Some of my hobbies growing up,
She's
some
the
of my
other
hobbies
side.
growing up was,
Yup.
So I was in the-
12, 13,
No.
14, I was in festival.
My brother
holidays,
was,
horse racing.
Yes,
And the colours and the
It is.
horses.
What was I saying?
I used to follow
Yeah,
things
touring your state.
religiously.
Probably
And where people had
Well,
sort
they're not
of
locked
pop stars and
Yeah.
whatever on the wall.
The country
I had
places are not so
photos
bad, it's
of
just in the city.
to
So,
use
so,
of children.
so,
Fantastic. I love horses when I was growing up too.
Teaching football.
Drove my mother crazy.
She lived with us and lived with Guy for a little bit, lived with
Lego.
for a little bit.
Nice.
Couldn't share around.
Sean.
Yes.
What was
Did
your
you have
first
any
car?
growing up?
What did you do?
Toyota.
Nice.
My first job.
Well, when she
Nice.
first job, she was been for a while.
What's your dream car?
And I was working.
In
She
KFC.
wasn't so bad, she just forgetful and remember some things, but I could still go to work.
Yeah, well,
Mine is a 1958 Buick Wildcat painted Pokemon purple.
High school car.
I've got to show you a photo. It's pretty damn
You bought it, you
I
should
did- I
know.
did-
Not
Not
like
like
it's a
it's
current job, is
Yeah,
it?
they're in
Now,
school,
going back
yes, in the
to the-
library, yeah.
What was your favourite
Yeah.
job?
Yeah, hang on, we haven't finished.
Part
that.
time.
They've got stolen.
I don't know, so we're looking at each
We
other.
had a library when I was at school called Miss Field,
Quite enjoyed it.
Okay.
that she
How did you and your
staff.
spouse
Oh,
make
no.
a partner?
That worked. Work together.
First trip I
One
took.
of my
I reckon.
teachers, when she wanted me
Can't
to be
remember
quiet,
further
or
back
one of the
than
class to be
this, so-
quiet, would just go,
Tell me if I'm wrong. First trip I remember taking is when we went through New South Wales and Victoria.
I wish I had
I'll
all
quickly
these
ask you
questions.
one.
Okay.
Yes.
I can remember.
Yeah.
Ah, just trying to see.
I remember-
Nickname when you were growing up.
Maddie,
Not
do you remember what holidays
More
I
than
went on
anything,
when
I
you were
remember
young?
going through Victoria.
I remember going to Zambia,
Yes.
and the accident you had, do you remember that?
How he said he
Yeah.
did.
You had little stitches in your head?
Brutal.
Oh, okay.
Do you remember which part that was?
Katoomba is the one I remember.
Yeah, that one. Yeah, but whatever.
Yeah, no, that was my fault.
Yeah.
After that.
We went to the south east. That was after that, wasn't it?
My uncle Murray,
Yes, what do you do now?
when you got it
Oh,
out
You
the
realise you're supposed to stay on top of the top post without falling.
Oh, thank you.
Forgot it.
Yes, I take the plug out of that power.
Oh, okay.
I'm not as good as you.
Yeah, it's a little bit on the road.
Yeah, right.
Alright, we'll bring it back in.
There's more about
It's easy to get lost in some of these
it
questions.
is.
But,
Yeah.
Just let me know it's 40 minutes.
thank you. It's always nice to get to know more about
Yeah.
those people. And these questions are more fun, but when you're getting questions from nurses or doctors, they're given their set of questions that they have to ask.
Yeah.
Some of them can be quite, invasive. They have to be because they need to know these things.
Yeah.
But I thought with these questions, they're more fun, they're more personal, not just a generic sort of thing. And it's always nice to get to know your residents more with simple questions like this. The more you can know about their background, the more you know how to help with their treatment.
Could that not cause frustration though, because they can't remember the answer to these
That's a
questions?
good question. It certainly could. And if in that case you know someone has more advanced dementia, these questions are something you could ask a family member. Maybe not so much the patient themselves.
Exactly, yeah.
Yeah, good question. Okay. Living well. We went through that. People with dementia, they want to live well. They want quality of life. They might not remember certain things, but they want to learn too. So maybe you're helping with different hobbies. Gardening is a huge hobby that a lot of the elder residents have at different nursing homes. I don't know if you've ever walked around the outside of a nursing home, but the gardens are immaculate.
Yes, yeah.
And they've got veggie gardens, and they've got all sorts, and most of the time it's the residents who are doing that. Here you go. Importance of communication, again, something else we've been through, but it is important, regardless of how the communication happens, whether it's non-verbal, verbal, the cue cards we went through. It's important to be able to express yourself and to be understood and heard. We all just want to be heard. Common problems with communication. We've been through the word finding difficulty. You can't find that word. What is that word I'm looking for? And again, everyone's got their own sort of style of communicating. Some people like being touched, some people don't. That's something else you'll find in care plans. Some people like pat on the shoulder, pat on the back. Some people you need to keep that good distance from for their own safety. Some people feel like, oh my gosh, you're invading my space. We've got aggression we've been through. Some people don't talk very much. And that's okay too. That's their own style of communication. And if they're not a big talker, when they do talk to you, you know it's a big deal.
Yeah,
Maybe not a big talker.
Oh, thanks.
Yeah, Matt, yes. That's all right, because we understand, Maddie, when you do talk, it's a big deal. Yeah?
It's important.
It's important.
It's not a going.
And everyone's kind of got their own individuality and how they like to be communicated with. It's important to understand that. Family, carers and friends. Now, if you've got someone in your home caring for a family member who does have dementia, you need to look after yourself too. So I remember talking about burnout, and that'll happen in every profession, not just nursing, not just caring, everywhere you will find burnout. It's important for yourself to recognise your own need and to say, okay, I need to take a step back, I need to enlist some help here, otherwise it's not going to end well. Okay, now that's the end of our slideshow today. So what stuck out for you today?
Oh, there's a lot that stuck out. It was all really interesting.
Yep.
definitely.
Did you learn anything new that you might not have already known?
Yeah, how to handle people when you're not sure what they want.
Yes.
How they're trying to tell you something, but not verbally.
Yeah,
Yeah,
different.
You know, just watching the signs.
Yeah, sure. Well, you all did really, really well today. Thank you all so much for participating. And next week, that's the end of our training sessions
Oh, wow.
on dementia. So
Yes,
thank you very much. And yeah, I have got a few things I just wanted to show quickly. If you wanted some more reading on dementia in your own time, you've got your care experience. Essential Guide of care, for Carers of People with Dementia. This is invaluable. And just a book about a woman trying to care for her mum. It's called Dance Again, Mrs. Pelican. It's a tearjerker, but it's a great book.
Yes.
So I'm going to leave them up the front if anyone wants to have a read. And thank you all for your time, and I guess I'll see you next unit.
Yeah, thank you. Thank you.
Thank you. Well done. Yay.
Check the time.